Dr. Jenn, you write that therapy is not neutral and never has been.
Mhm.
How did you come to this truth in your own practice? And was there a moment of rupture or realization, or how did you get there?
Oh, such a beautiful question. Especially being in a body of culture, which I'm sure you know a lot about, Ia, there's this realization almost immediately that nothing is absolutely neutral, right? Everything has a charge, an energetic charge, an emotional charge, a cultural charge, but especially being a clinical psychologist, everything was about pathologizing. And everything was about putting something neatly in a box, trying to figure it out, check it off. Where do we put people? Where do we put symptoms? Air quotes. Where do we fit in? And there was this realization. I'm going to be honest here. There was this realization midway in because I deeply loved my work, right? Like a lot of therapists and practitioners do. Deeply loved being there for others, healing, working with. But I was always hiding parts of myself, right? I was always hiding this bigger personality, these other ways of knowing with a capital K. I was always sort of in these closets spiritually, somatically, energetically. There were rules and regulations about what we're able to talk about, what we're not, what we have trainings around. And all along, a lot of our people, many of our people's indigenous medicine and histories are being co opted, are being appropriated without honor, without reverence, and without permission. And so this started weighing on my spirit. This weighed on my physicality. This weighed on the type of work that I did. And I found myself doing all the right things for self care, right? Working out and meditating and acupuncture and this and that, drinking a gallon of water a day. And there came a
Mhm.
point in the realization, right? You're laughing because you see, right, the truth of that, right? The self
Yeah.
care, this myth of self care, and this is what it looks like, and sell this to people in this manner. And I realized, wait, I'm doing like the jobs of seven people, right? I'm not just doing therapy in this university counseling center, but I'm also teaching grad courses and running a peer education program and running and co-facilitating an LGBTQIA support group and grants and this and within this realization and entering the shamanic practice, coming back to my peoples and my medicine within a week of having this activation, which I didn't know was an activation at the time. I ended up in the hospital with dehydration. And what's pretty fascinating about that is that I was drinking more water than I ever had in my entire life. And as I was laying there, I thought, well, actually, I heard, felt, received, right? This is a soul dehydration, you know, and the questions that I kept writing out for myself is, where's the joy? Where's the reclamation? Where is your full expression of authenticity? Where is your voice that we have given you? And I believe that was my ancestors speaking, really, we've given you this voice and this honesty and this little bit of childlike wonder and ferocity. So where is that in speaking to the fact that this work is not, in fact, neutral, right? There's nothing neutral about not having clean running water. There's nothing neutral, right, about not having your pronouns utilized. There's nothing neutral about taking really big reactions to grief and rage and pathologizing them and just constantly medicating them without getting curious about the root of the dis-ease and the separation with self.